Good morning, good afternoon, or good evening from wherever you're calling into. And welcome to the CUGH webinar on global health policies, priorities for the new Biden administration. I'm Michelle Berry, the chair of the CUGH board, and Heath Martin, the executive director of CUGH, will be talking. I just want to let you know that this webinar is really about listening to you. We're going to give a brief overview of some of well, Keith will start with the general challenges during this greatest pandemic of our lifetime. But what are the opportunities for global health? What are the political considerations as Joe Biden and Kamala Harris enter our administration, thankfully? And I will basically take it after that to try to really talk about some of the hard facts about what's happening in global health. And at the end, share a potential wish list and talk to you about where the Biden administration is headed with global health. I'm going to now just remind you that this is really about, we're trying to compile your comments and then pass them on to the transition team. So please write comments and Q&A as we go on, or as we talk. So Keith, why don't you take it away?
Thank you very much, Dr. Berry. And as Dr. Berry said, welcome to this webinar. I just want to remind everybody, you'll have a section, a box for questions. You can start submitting your questions or your comments very soon, and we will introduce that into the conversation with Dr. Berry and myself. We will compile your top 10 ideas for the new Biden administration, and then we will share that with them, but also make that public so that you'll know what we have heard from you and what we've put together. So as Dr. Berry said, this is really a great opportunity for you to share your views with us and through us to the Biden administration so we can build forward better. Next slide, please, Jenna. So I think all of us will recognize that when President-elect Biden and Vice President-elect Kamala Harris enter into the White House, they really have an unprecedented series of challenges. In fact, one would be hard-pressed to actually remember a previous incoming president who had so many challenges on the docket that they have to deal with. Not only the COVID-19 pandemic that has ravaged the world, is the greatest public health challenge we've seen in a century, but also the non-communicable diseases that are accountable for 70% of the world's deaths, the immense impact of climate change as an existential challenge, but also all the other environmental challenges we're faced with, from pollution to biodiversity losses, to political uncertainty and political insecurity that's taking place around the world, and to a rise of a political dynamic that's really affecting, I think, all of our ability to really move forward on a lot of these challenges, particularly the rise of disinformation, nationalism, and a severing of the ties that bind countries together. So next slide, please, Jenna. So as we sort of encapsulate the domestic political challenges that are faced with, there's always an internal domestic opposition to moving forward and dealing with international affairs. Some people want to deal primarily or only with internal affairs and look inward. And in fact, we've certainly seen over the last few years in particular a rise of nationalism and inward lookingness here in the United States. But I think all of us know, and the COVID-19 pandemic clearly shows us, that we're bound together, and the challenges that we face are transnational, they run across boundaries, and we have to work together to be able to deal with them. So the rise in nationalism is a real challenge for the new administration, as of course is the anti-science movement that seems to have grown in strength, and its spread has been very worrying. And the disinformation that has been spread out through various mechanisms are really affecting our ability to move forward with a science-based policy, evidence-based approach to problems. The scapegoating of minorities and vulnerable groups have been held up as straw men to take one's eyes off internal problems. The assault on public institutions, the weakening of public institutions we have seen over the last few years is certainly a very big challenge, and the new administration has to undo that and build on the great public institutions this country has and strengthen them. As I mentioned, the disinformation networks have to be dealt with if we're going to be able to have an informed citizenry that is able to and support the policies that an administration wants to pursue. The undermining of the press that we've seen is a very disturbing element and undermines democracy. And of course, the internal economic situation in the United States is very fragile and will have to be strengthened. Next slide, please, Jenna. So some of the general challenges, of course, are also opportunities. And part of the new administration will have to rebuild trust internally, but also with our allies overseas and within organizations as President Trump has retracted and moved away from a forward-leaning, outward-looking administration that previous US governments have pursued. The rebuilding of trust is going to be important because it certainly has been negatively affected. So re-engaging internationally with the WHO, the COVAX facility and others, the rebuilding of alliances, re-entering international agreements that President Trump has removed the US from, how resources are allocated for global health priorities is going to be important for the new administration. And again, dealing with the domestic economic situation is also going to be a big challenge, but it's also an opportunity. As the economic situation is dealt with here, it's an opportunity to build forward better to deal with long-standing internal disparities in the United States that have not been dealt with. And I think this is something that the new administration will look forward to. Next slide, please. So some specific challenges and some opportunities. Dealing with, of course, the primary challenge, the SARS-CoV-2 pandemic. Addressing the issue of equitable access to vaccines is going to be very important, both here inside the United States, but also importantly outside the United States. We know that the rich countries have actually absorbed and acquired the majority of the vaccines that are going to be produced. We have to find a way, and there is a way for that to be access to vaccines to occur more effectively. It's a matter of everybody's security and everybody's health. Public health strengthening, public health being the runt of the litter in most investments by governments, has to be addressed. Public health, of course, is the way not only to deal with preventing, detecting, and responding to pandemics, but is also vitally important to prevent and address the non-communicable diseases. The vaccine disinformation, of course, how we deal with that, how we work with the public to inform them so they absorb the evidence behind vaccines. You can have a vaccine, but if it's not used, we have a problem. And 50% of the people in the United States right now say they will not take a vaccine when one is available. Global health security agenda, the US led that. It can be strengthened, again, to prevent, detect, and respond to future pandemics, which will certainly occur. Next slide, please, Jenna. So a specific challenge, opportunities, the second part is how we deal with long-standing disparities, equity within the United States. Minority groups, the poor, have been disadvantaged for a long time, and there are structural obstacles for them to be able to acquire the public goods they need to be able to provide for themselves. That needs to be dealt with, and I know the Biden administration will be consumed by that. The non-communicable diseases, the infectious diseases, both existing and new ones. Environmental challenges, as I mentioned before, not only climate change, but also biodiversity losses, pollution, ecosystem degradation, addressing the social determinants of health, food security. Next slide, please. So finally, academia's opportunities we were on a call yesterday, a Facebook call with Dean Trish Davidson from Johns Hopkins, who put together a wonderful Facebook talk about the role of academia in the COVID-19 environment and how we build forward better. So there are opportunities for academia to be able to increase access to education for minority and disadvantaged groups, to engage low-income communities that they're close to address student debt. Student debt's a massive problem in the United States, and it can and needs to be dealt with. Capacity building in low to middle income countries, how we partner equitably to really ensure that capacity is built in low income countries as defined by them, and increase in supervised service learning opportunities. Finally, on the research side, have more equitable partnerships in research, making sure that more of the research that's produced is actually translated, connecting research to the local needs of communities, and to rethink tenure as a way to incentivize reform within academia. All things that can and should be addressed. So I'm going to turn it over, I think the next slide, please, Jenna. I'm going to turn it over to Dr. Barry, and please remember to write in your questions into the box that you have on your screen. Thanks very much. Michelle, over to you.
Thank you, Keith, for that overview. So I'm just going to spend a few seconds talking about some of the hard facts and also where the Biden administration has promised in their plan to go with global, although obviously things are really being concentrated on the domestic issues right now. But the hard fact is that global health funding in 2021 dropped by $4 billion. That was the request for Congress, went from 11 billion to 7 billion. So I think what needs to, and what everybody's talking about, is that we need to be strategic in our approach if we're going to be advocates for global health. And we need to link it to US priorities in order to get it through Congress. May I have the next slide? So where the Biden administration has sort of talked about in their global health proposals, and I was fortunate to be part of their transition team thinking, is one, obviously, he has promised to re-enter WHO and embrace the global alliance, particularly the global alliances, particularly the Paris Accords. He has promised to restore the National Security Council's Directorate for Global Health Security and Biodefense. If you remember, this was something that the Obama administration had and the Trump administration disassembled. He actually, interestingly, proposes to develop a global health emergency board of the US and G7 to offset vaccine costs for vulnerable countries. He wants to relaunch USAID Predict project, and maybe a little bit later I can talk to you about what that is, because it becomes very pertinent to pandemic preparedness. He has proposed to develop an Office of Global Health Security and Diplomacy, which is to be run in the State Department. And he has called for a permanent facilitator of the UN as the Secretary General in order to respond to high consequence biologic events. And lastly, but not least, he wants to bolster CDC and DoD overseas detection and prevention. And as you know, that has been really cut dramatically. In fact, one of the problems when the Wuhan epidemic started is that we did not have a full complement of CDC people that were on the ground, that had been on the ground in China. May I have the next slide? So, again, we're giving a brief overview. And what we wanted, this is not for us to talk so much as for you to give us what you think are important and what we can translate to the team. So this is, I figured I'd start with my own potential wish list for the Biden team, which is one that we need to emergently enter COVAX, which is the Advanced Market Commitment Incentive for Vaccines. And if you remember, that is the WHO, CEPI, and Gavi collaboration. We need to have a humanitarian plan for UN COVID-19 that just is not totally focused on the US. Now, it's really hard for me to say that because I'm in California, where we're overwhelmed right now with COVID-19. But we have to remember that this epidemic is not just in the US, and that strengthening future ability to control this pandemic will mean to think about vulnerable countries as well. The USAID farm budget has been dramatically cut under the Trump administration. And so far that there's been no talk about what to do with that, but we're hoping that there will actually be a budget, and particularly devoted to global health. We would like the malaria, TB, HIV, at least this is my potential wish list. And that's what we're asking you to sort of write in as I'm talking. But actually, we need to cross the goals that we have. Um, Obviously, as we're all overwhelmed with COVID-19, certain things like bed nets are not being produced in the way they we're doing. The Cepheid testing has been shunted away from TB onto COVID-19 appropriately, but we're seeing increases in malaria, TB, and HIV. We're seeing food insecurity. There's double amount of people hungry. And I know that David Beasley's done a great job with the World Food Program, and as you know, they won the Nobel Prize this year, but they're very short in cash. So we'd like to see the U.S. I would like to see the U.S. Put some more money into this. I think we need to depoliticize the CDC. Many of you may have read the recent New York Times article about how there are two whistleblowers talking about how politicized the CDC and how hamstrung it was during this administration. And really, there was a complete cutback on foreign travel. So we need to reestablish foreign offices. I didn't know, and it was really interesting that we have completely left the UN Human Rights Council, and we need to re-enter that if we're going to be a country of significance. And then the area that I've been very interested in recently is human and planetary health, and that I had the honor of working on that for the first 100 days. And you've already seen some of the proposals that have come out around climate science. And that is the fact that John Kerry has been made a federal White House person for climate. And Gina McCarthy, who used to run the EPA, will be the person that will coordinate all of the climate activities in the government. So the domestic diplomacy around climate. But what we didn't hear so much about, and which I'd love to hear more about, is strengthening the CDC's ability to look at climate science. And hopefully climate will no longer be a dirty word. And some people have actually suggested that we have an institute of climate science at the NIH, where more science money can be attributed to climate science. So that is, may I have the next slide? I think that's my potential wish list. And really, what we wanted to hear from you, our constituency, is what you would like us to bring forth around this new administration. So Keith, or whoever, Jenna, who's ever doing the questions, I'm going to take my webcam off. Well, actually, I'll keep my webcam on.
Great.
So
Thank you very much, Dr. Berry. That was excellent. And thank you for everybody for turning in your suggestions. We had quite a number of them.
oh, good.
And
Good.
so I'm going to start. Yes, there's quite a good long list. So we're going to get through as many of them as possible. And you've got quite a variety of suggestions. So please keep sending those in. They're superb. So the first one, Michelle, was on navigating the China-US relationship. It's very difficult, particularly in the face of the outbreak of the SARS-CoV-2 virus coming out of Wuhan, and the political challenges that are taking place between the two countries on many levels. But the suggestion is, how can we, it's very important for the Biden administration to find ways to resolve or negotiate that particular relationship between the United States and China. I don't know if you have heard any views on that, or coming from California.
No, I haven't, but I think that's very key. I mean, I think this is not so much key for us to comment about it. I would like to gather the questions and then actually put it forward. But I will share something about the US-China relationship that is very pertinent to global health. And that is what happened to Eco Health Alliance and Peter Daszak, which I've been involved in. And that is the fact that Peter had a large multi-million-dollar grant with the Wuhan Virology Lab looking at coronaviruses in bats. As you know, there are actually, he identified over 700 species of coronaviruses in a horseshoe bat in China. And the NIH actually took back his grant. This is what I was talking about earlier, how politicized, and I think whoever asked this question, actually, Keith, you should identify who asked the question so that we
Yeah.
know a little bit more if they identify themselves. But this becomes really important. 77 Nobel laureates and some very low-level people like me actually signed a letter really to Francis Collins asking him to reverse, because it's unprecedented that you would take money away. And this was pressure by the Trump administration that they asked Peter Daszak to actually literally take material from that lab and share it with the US, which he did not have access to, nor did he want to. So navigating the US-China relationship for global health, as opposed, I mean, obviously for other reasons too, but global health becomes crucial. That's all I'll say. I will say that China did share that genome quite quickly, but as we antagonize and make that relationship more difficult, we're going to have more difficulties in sharing science, in particular with what happened to Peter Daszak. Heath.
Thanks, Michelle. And the next one comes from Dr. Jindal from the Uniformed Services of the Uniformed Services University of the Health Sciences. And Dr. Jindal has been a leader in global surgery, and he's suggesting that there be a global surgery bureau within USAID, reflecting on the huge and neglected impact, impact of injury around the world, and that surgery tends to be forgotten about as being an important pillar of a healthcare system. I don't know if you have any views on that, Michelle. But
no, I think that is a really incredibly important issue. In fact, there's a faculty member at Stanford, Sherry Wren, who's been instrumental in talking about the lack of global surgery, as has Paul Farmer, and the need for this. I love the idea of a bureau. Where would you put that bureau, Dr. Jindal?
Dr. Jindal is suggesting that there be one in USAID.
Got it.
So it's a great suggestion. In fact, we've been running with Dr. Catherine DeVries out of Utah and Dr. Mamta Swaroop and others, running a global surgery day for 3 years in a row, and with the American Academy of Sciences. So, Dr. Jindal, we look forward at CUGH to continuing to advance that, and I know Dr. DeVries and Dr. Swaroop, we will have another global surgery day at our conference next March. A satellite session, a half-day satellite session, bringing together not only surgeons, and this is an important point they make, we're looking at the global surgery ecosystem, from cleaners to nurses to engineers and to surgeons and to all the other people that enable others to treat surgery. So we really encourage people to attend that Global Surgery Day, which will take place in early March. So stay tuned for that.
Also, Dr. Jindal, can I just say one other comment? I was talking about Dr. Wren. There's a great paper that she put out with bringing together a consortium of folks thinking about this, about how to do surgery during the time of humanitarian crisis. And if you Google that, WREN, it's new guidelines for how to actually take that on.
Yeah. And I would just encourage.
Keith, is there a way that we can open, or Jenna, the microphone so we can have a back and forth with the folks on the webinar? I know that's unusual, but I would love to do that. No, okay.
Unfortunately, we can't.
Okay.
We're not that sophisticated.
Okay.
But so Dr. Sherry Wren is who Dr. Berry is talking about. Sherry Wren's also done great work on capacity building in low resource areas in Africa. And again, I certainly echo that for what Dr. Berry mentioned. The next issue is an important one that often gets neglected, Michelle, and that's the issue of equalizing trade issues between countries and including strengthening environmental regulations, issues like child labor laws. And as we're negotiating those trade agreements, to make sure that environmental regs, trade, labor laws are actually embedded and enforced within those trade issues, to equalize trade, and to make sure that the interests of low to middle income countries are actually included in international trade agreements, because they're often not.
Important point. Important also about the environmental justice aspects of that. And again, child labor laws, incredibly important, as is trafficking, the issues of trafficking.
Absolutely. So
Okay.
Dr. Quinton Eichbaum from Vanderbilt University is suggesting again that whereas President Trump may have certainly walked away from the continent of Africa, that the Biden administration re-engage the continent of Africa, particularly in the area of capacity building in health systems.
Yes, Quentin, thank you for that. And I think we also need to think a little bit about how we sort of work about decolonizing global health, and how when we re-engage with Africa, because I think Africa has taught us a lot with this epidemic, how much better that they're doing, recognize that there's equity in partnerships. And when we re-engage, we should really re-engage with humbleness.
Absolutely, and I would encourage for those who are on right now, take a look at the work. Dr. Eichbaum used to chair our education committee, our current education committee, and their subcommittees are working with our colleagues on the African continent in capacity building. So please take a look at the work they're doing, and we would love to be able to work with you in those efforts. Currently our teams are working on capacity building for nursing, mental health, primary care, and cervical cancer, amongst other areas. Michelle, so Dr. Mitra has a suggestion about strengthening the World Health Organization. Well, so it wasn't Dr. Mitra for that, but there was a suggestion about strengthening the World Health Organization. So not only re-entering and supporting financially the WHO, which has such a low budget relative to its responsibilities, but also looking at reforming the administrative structure within the WHO, strengthening oversight in terms of where monies are spent, strengthening the Director General's office, but also putting in control oversight mechanisms to make sure the monies are going where they're supposed to be going.
So that's a great point, but I'm not sure the Biden administration can really take that on. And I think that's what this webinar is supposed to be directed to, is what we can bring to the team. But what we can suggest to the Biden, taking that and trying to understand and do a little bit of a deeper dive in that, is that we can suggest that we reestablish funding, and that once we reestablish funding, we then have a voice at WHO. And when we have a voice at WHO, we can talk about restructuring. Right now, and it's really hard when you think about, WHO has a budget of about 5.6 billion, which is about, Stanford Hospital has that budget, and they have the 5.6 billion over 2 years. So they're really, and most of that budget is, they get 17% from member states, and 80%, a little bit more than 80%, from what they call voluntary assessments, which are really earmarked from private organizations, the Gates Foundation. So they're earmarked projects. So it's really hard for WHO to be impactful. When you look at GORN, the Global Outbreak Response Network, for the entire WHO, there are only 8 people on staff. Now they have 800 collaborating centers, but there are only 8 people that are responsible for pandemic preparedness. So I agree with this constituent that there needs to be reform. But I think the best way that the Biden administration can do that is really by putting money back into it. And again, that goes back to navigating the US-China relationship, which is what Trump one of the reasons why Trump pulled out.
Indeed, it is. So then Dr. Mitra has a suggestion. She is saying that we've got to take a look at healthcare professionals that are coming into the United States. There's been real challenges for them to be able to access the visas that they need. And if we've seen anything, there's certainly structural problems in terms of regional areas where healthcare workers in the United States are needed. And the Biden administration could, because it's certainly bipartisan support, to be able to facilitate the ease in which these health professionals can access the visas they need to be able to work in the United States.
So again, that's a great point. Again, that's more of a domestic issue than a global health issue. And I didn't talk about where the Biden plan is for domestic professional workforce. But yes, he has suggested that he was going to re-embellish and grow the public health service, which is not what your question's about. Your question, I think, if I'm interpreting it correctly, but again, we don't have a back and forth, so it's hard. It's mostly about GME or foreign professionals needing visas. And, you know, I was on the board of FAMR, which is part of, anyway, a foundation that looks at this. And actually, these folks that have visas and come in from other countries do the majority of the work in our rural areas. So yes, there's no question about that. We're in a crisis now. There's no question that we need to get visas. You know, again, this is not the session of, you know, our just opinions. It's what we can bring forward. I do want to, if we're going to talk about global, I've spent a lot of my career working on a global health service that we can organize and put together to actually be mobilized during pandemics. Particularly, we saw during the global Ebola outbreak that there really wasn't enough manpower or woman power. And so it would be great to have a global health service corps. Fitzhugh Mullen and I tried to get one through with a bill with Durbin. Vanessa Carey has really started a wonderful thing called SEED, where retired physicians can actually volunteer to go overseas. But it would be really nice if we had a global health reserve corps that was really assembled by a central body, whether it be UN or WHO. But certainly, and I believe Gillibrand, Heath, is working on something like that, right?
Yeah, that's correct. Yes, they do. They do have a global health corps where it's actually a very exciting initiative that we at CUGH are supporting. And essentially, what Senator Gillibrand and others are proposing is that individuals who are living in low resource areas in the United States, where the burden of non-communicable diseases in particular can be very high, that individuals in those areas that they are trained in community healthcare work, that they from those communities, and then they can provide some of the community healthcare, public healthcare services that are so desperately needed in those areas where there's very high incidence of non-communicable diseases and huge disparities with other parts of the United States. So it's a very exciting bill that she's put forward. You're right, Michelle. Another, did you want to talk a little bit about Predict, Michelle? You were going to mention a little bit about that.
Oh, yes. So I did want to talk about Predict, because that's been something that's been defunded completely. And that was on my wish list by the Trump administration. And Predict is something that was started in 2009, really to detect and discover new zoonotic viruses, such as coronaviruses, such SARS and MERS, and paramyxoviruses like Nipah, the filoviruses like Ebola and influenza viruses, and emerging new viruses. They were active in 31 countries. They had a One Health approach. And in the time that they were active, they trained 2,500 people in laboratory diagnostics and surveillance, in capacity strengthening, in information management. And even behavioral risks for spillover, which we understand that behavioral risks play a huge role. And I would love to see that refunded. And along with that, the global health security agenda, which was something started in the Obama administration, which also helped build capacity for countries to respond to the international health regulations, the IHR from WHO. And again, if anybody has a question about any of these, put it in the chat, but I don't want to go too quickly or use too many WHO acronyms. But the international health regulations also need to be strengthened. And again, the US could be a leader in helping strengthen these.
No, it's very, very true, Michelle. And leading on to that is a question concerning the One Health approach. This individual submits that One Health is really spread over quite a number of US government agencies, and it really needs to come together under one roof. I think if anything, we've seen the importance of One Health in addressing the COVID-19 pandemic and also preventing it. I know our friends at the American Association, the AVMC, the American Association of Veterinary Medical Colleges, Dr. Andrew McCabe and their team have been really fabulous, as have the team at Davis, UC Davis, with Dr. John Amazette and Pat Conrad and others. So I don't know, Michelle, if I think the suggestion is certainly to bring One Health under one umbrella in the U.S. government. I don't know if you had any views on that.
Yeah.
Great.
We'll take that forward.
So Stephen Summit is suggesting that he's really not hearing enough about accident and injury, it being a huge impact in disability adjusted life years lost, and suggesting that that there needs to be a strategy on accident prevention, injury prevention, and treatment in the United States' development agenda.
I presume he means global development, not you. I mean,
no, yes, global health development, USAID.
Yeah.
The USAID needs to put
So
injury prevention treatment
sounds like
forward.
Right, as it's the fourth most common. Yes, I agree. Can you ask him to be right back, or I'll ask him about how he would envision that, so we can bring that forward, of how you would envision some centrality for looking at that. I know that WHO has a division, but again, the problem with global, not the problem, what WHO is it gives guidelines. It's not an enforcer. It's not a regulator. It gives guidelines. So I think we have to look to them for guidelines on how each country should enforce issues around road injury. I sit on the board of the National Academy of Medicine, the Global Health Board, and there is a task force that is starting to look at this and make recommendations as well.
Great. And I know that our friends, Dr. Yannis Tupensis and Dr. Katie Wells and others, they're going to run, by the way, again, for our conference next March, we will have, I think, our third emergency medicine satellite session. So they're really dedicated to strengthening emergency medicine capacity in low resource settings. I'd encourage you and anybody else to attend those satellites. They're free to attend. And we're not only looking at emergency room physicians, but importantly, we're looking at the array of individuals who are involved in emergency care. So please stay tuned for that. And Dr. Tupensis and Dr. Wells and others have been real leaders in that. So we're grateful for that. One thing
if one wanted to find funding on that, because I also am involved with the Fogarty Institute, there are ways to actually access funding to look at that if this person is interested in researching that. Fogarty has become very interested in thinking about that and giving grants in that area.
Fantastic. That's a great point, Michelle. Paul Geist and others have a question concerning refugee policy. And I know what we saw on the US border really was chilling to many of us with what the Trump administration had done to people fleeing for their lives. the suggestion is that we really need to reform the immigration and refugee policies that have been implemented by the Trump administration and to undo some of those so that refugees and migrants are treated in accordance with international law and norms.
Stay tuned. Biden is very positive about doing that. If you read I really suggest that you go to his website. He has very excellent plans that are put out there. But we can bring that forth as well.
Great.
It's incredibly important. Those 500 children that will never be one of my colleagues is now looking at the border to actually look at how these children are being cared for. And the Flores case is about to be determined. So we'll see what goes forward.
And you're going to be participating in a part of a webinar coming up early next year on child health under. Do you want to say a little bit about that, Michelle?
Well, that's not about refugees so much. It's about the humanitarian crisis and
Yes.
what happens to children in conflict. We're launching a Lancet series on this, and my colleague Paul Wise and I will be doing a seminar on that with the launch of the Lancet Commission.
That's very, very important.
Series.
Yeah, we're having lost generations of children who were in refugee camps that don't have their basic needs met, don't have access to education, and that's a massive. Not only is that a humanitarian, an ethical and moral failure, but it's also a tragic humanitarian loss for those kids.
But a very interesting study that looks at children in conflict, that even if you go, 25 kilometers, 50, 100, far away from the conflict, it has ramifications with stunting and malnutrition. It's a really nice curve that looks at the spillover from conflicts for children.
Yeah. And I think that also the point you made early on about the plea for the World Food Program and the impact that a lack of nutrition has on children's neurodevelopment is really extraordinary, isn't it?
Yeah. And by the way, the launch of that series is January 25th, if anyone's interested.
Great. And we will be having a webinar, as Michelle mentioned, and on this launch. So please stay tuned at the end of January, beginning of February for that launch of that.
But again, we'll bring that forward about how important that is.
Absolutely.
Crisis. Yeah.
Great. And Meredith Garton is suggesting that that they can take a look at a number of suggestions with regard to reforms to assist immigrant children and families at www.theyoungcenter.org. And she's suggesting that if we take a look at there, you'll find some really good policies at theyoungcenter.org. So we'll thank you, Meredith, for that. We'll definitely take a look at that. And Anne, sorry, Michelle, go ahead.
Do people have access to the chat that they can get those?
No, we'll compile everything and we're going to share it publicly, and it'll be. That's a good point. We'll be sharing this publicly on our website in the new year once we compile all of your great ideas together. Anne Dressel said, related to your comments, Michelle, that we need to get the UN Sustainable Development Goals on everybody's radar screen because it really isn't as much as it should be. Many people in the US have never heard of the Sustainable Development Goals, and they complement a lot of the ideas that you are putting out, Michelle. So Anne Dressel is suggesting that we certainly loop back and make sure people are aware of the SDGs.
Can I just make one other comment to Dr. Dressel? Please write op-eds. It really is important to get your message out there. We'll bring it forward, but all of us have voices that matter. And if you can really take some time to write it, we're all stuck inside in quarantine. So it might be something that you really should do.
Yeah.
I think we as physicians are not as good advocates as we should be. I actually run a fellowship on for physicians on multimedia and basically teaching folks how to do the op-ed journalism and work with media. So I just think it's so important. Again, it's not for people at this stage on this conference, this webinar, but more for medical students as they go along.
But an important point that we all need to do a better job of actually communicating with the public. I would just encourage people to take a look at our website, cugh.org. We ran a couple of training sessions earlier this year before our Global Health Hill Days, and they will share with you along the line, just as a complement to what Michelle said, how to engage the public, how to engage the media, and how to engage Congress. So those are free, open access training sessions that are on our website. So please feel free to take a look at that. One thing that, Masvita Rankin is making an excellent point on the fact that the people who are leaving South and Central America are being driven northward because of extreme violence. And I think we've certainly seen of late in the New York Times very good reporting on the amount of murders taking place in Mexico. So what Masvita is suggesting is that to the Biden administration is that we have to look at the US's responsibility in being a driver of that, both in demand for drugs, but also as an exporter of guns. And I think that a point to make is there's only, I think, one legal gun shop in Mexico, and the millions of guns that have flooded into Mexico, Central and South America have been essentially sold, flooded by European gun manufacturers, but also American gun manufacturers.
Thank you for that comment.
Yeah, it's an important one. I just want to draw to Dr. Steve Hargarten and others have worked with us at CUGH and leaders within Mexico and Colombia to know how we can actually reduce gun violence. Now, I would just also draw your attention to the great work done by the Chicago Crime Lab that have actually done a really tremendous job of using data to identify individuals at risk and how you can identify those individuals and hopefully prevent a lot of trauma from occurring. A question that we have here is concerning about the repurposing of drugs. And I don't know, Michelle, if you have any thoughts about, NRAO talks about the need to find ways that we can repurpose drugs for other uses and how that can be facilitated.
I think that's a great, I think it's a great idea. We spent a lot of time at Stanford running a Spark program where you could repurpose drugs to actually really take over some of the more expensive pharmaceutical drugs. I think we depend a lot on India and their pharma industry to make cheaper generic drugs. But I also think we need to work on the TRIPS agreement, where we're allowed to, bypass some of the patents. And that would be something I'd love to see the Biden. I'm going to put that on my wish list also, to see the Biden administration. Keith, put that down. That's another wish list.
Oh yeah, we've got some great suggestions.
It's a really important point.
Yeah, you're all giving us really good suggestions, so thank you. They're just coming through. They're wonderful. Dr. Kilmarks has challenged us to suggest how we need to redouble our efforts to build global health research capacity, example in the Fogarty Institute. So, Michelle, you're in the Fogarty, on the board of Fogarty. I
used to be. I'm a graduate of the board. Peter is much more versed in what he needs. Can he write in the Q&A? I'm sorry, we can't go back and forth. But clearly more money is needed, Peter. I totally agree. But if you can get into more specifics, so how we can lobby for what you need, that would be very helpful. Peter is the I don't know, are you the executive director? You work with Roger Class. And I think that would be great if you can give us some suggestions that we can actually bring forth. Was there anything more specific in that comment?
No, he was very to the point. increase our resources for Fogarty, which is really important given that it's the least funded of all the NIH institutes.
So, Peter, I would like to go back to Peter and ask whether, is there a way that we can globalize some of the other institutes? I know that they donate to some of the Fogarty, very small amounts to Fogarty's mission, but is there a better way to be able to globalize each one of those institutes?
Yeah,
He can, I'm sorry,
we
he
will,
can't back and
we
forth.
will, yeah, we'll certainly find out that offline.
Right.
So Dr. Lois Cohen has got a very good suggestion, and she makes the point about instead of focusing on particular individual diseases, that we put a greater emphasis on building the infrastructure that countries need to be able to prevent, detect, respond to a wide variety of both infectious and non-infectious and environmental challenges. So she's looking at structural, foundational, public institutional strengthening that would create the infrastructure to respond.
I
Yeah,
think Julia Walsh many years ago wrote a great paper looking at the difference between vertical programs in global health and horizontal programs. And I think I'm sorry, this person's name was Julia.
no, who actually wrote was Dr. Cohen.
Dr. Cohen.
Yeah, both.
I think that's a really important point. The question is how to get that to the Biden administration. Would you see that as something that USAID could do? What area of the government would be best to push for that? I mean, I know we've pushed at Gates for a long time to do healthcare strengthening, and they're just starting to do that. They've been much more a vertical program focused on vertical issues. But I totally agree. But
Right.
again, if you can make a more specific suggestion of where you would like us to push, that would be great.
Great.
That's what
And
this webinar is supposed to be for. Webinar.
And Dr. Geist Professor Geist has come up with some really excellent suggestions about the global health landscape, and is suggesting about the need for, again, dealing with disinformation campaigns, addressing cybersecurity, and we just saw the massive security breach here in the United States, which is a colossal challenge, and the need to train both policymakers and global health professionals on how to communicate to deal with the disinformation that we're all facing.
Excellent.
Yep. And I would
Okay.
just encourage folks to look at Dr. Michelle in London School of Hygiene and Tropical Medicine, Peter Piot's.
Heidi Larson.
Heidi Larson. So Heidi Larson's work out of the London School of Hygiene and Tropical Medicine, Ed Maybach's work on climate change, Peter Hotez on vaccines, they've all done really good work on how to communicate with people who have absorbed disinformation and are throwing science under the bus. So I would encourage people to look at particularly Dr. Larson, Heidi Larson's work. She's done a lot of work in this space for a long time. So, and thank you very much, Paul, for that, to be sure. We're coming up pretty close to the top of the hour. Michelle, are there any other, I want to just mention this from Hawaii. Our colleagues at the University of Hawaii, Amy Grace, just wants us to make sure that we prioritize the health of Native Hawaiians, Pacific Islanders, and I will just edit that and make sure that Indigenous peoples here in the United States that have hardly received the attention that they should become a priority within the Biden administration. And I just want to.
I think he just appointed, and I didn't see the name today, an Indigenous woman from New Mexico to be, I think, Secretary of the Interior.
Correct.
So
That's right.
I think he's paying attention to. I have to say, I've been very impressed with the people working around the Biden administration. Again, I am not a political person. I am a tropical disease person. I have political interests, but it was very interesting to work with the transition team. They have a wonderful group of folks working together really hard. And for me, it was an honor, and I was humbled by it because it was just a wonderful. They're going to do good things. The problem is they've inherited a mess. So the question is, what can they do with this sort of legacy that they've inherited?
Yeah. And Dr. Grace, Amy Grace from the University of Hawaii. Thanks, Amy, for being on this from such a long distance away. She also brings the point about something called the Compact of Free Associations Citizens, that they become eligible again for Medicaid. That's an important priority for them, obviously. And she brings that important point up. So thank you very much, Dr. Grace, for doing that. Finally, and this is from Shelly Prasad. Before we close, Michelle, Dr. Prasad is bringing up the really important point for universal health coverage, and that we need to make that it's a WHO priority. It needs to be a U.S. government priority. Turn it over to you, Michelle, if you have any final points on that.
Right on.
Yeah, it seems.
But these are important. The more we bring it forward, and the more we talk about it, our voices matter, and they matter much more now with this administration. So I hope this webinar has been helpful to you. And we're going to try to push as much as we can during my term to actually be more of an advocate. And Keith's been great at that. But we'd like to, I think we'll get more traction now with this administration. So thank you all for participating. Keith, do you want to say a few words where it's at the top?
Yep, thank you very much, Michelle. And I just want to before I go, Dr. Eichbaum has made up 2 great points that tie into our surgery. Dr. Eichbaum, who is says we cannot forget pathology and diagnostics as a critical element of surgery. So thank you very much, Quentin, for again bringing those important points up. And as Michelle mentioned, everybody, we're here at CUGH to serve you and to serve people around the world to make sure we improve the health of people and the planet. That's our mission. I would encourage you to participate in our webinars, participate in our virtual Global Health Conference next March. From the 1st to the 11th, we're going to have over 31 satellite sessions. These are half to full day sessions. They will, for the most part, be free to attend. You are welcome to attend. Please sign up for them. You'll see them on our website at cugh2021.org. And we will only be able to be successful if we come together across disciplines, across countries, to collaborate together to deal with the challenges before us. And if anything, this COVID-19 moment, for the tragedy that it is also an opportunity, of course, for all of us to build forward better, to deal with the challenges that have not been dealt with, and to address them in the future. So on behalf of all of us at CUGH, on behalf of Dr. Barry, our team here at CUGH, and big thanks to Jenna and who produces these, and Dalal for assisting her. Thank you for attending this webinar. It will be on our website in the new year, and we hope all of you have a safe holiday season with your loved ones, and we look forward to seeing you in the new year. Thanks for attending the CUGH webinar.
And please give us feedback if this is something you want us to continue to do. And you can let Keith Martin know that, but it would be helpful to us as well. But have a wonderful, healthy season, everybody. Thanks, Keith.
Thank you, Michelle.
Great idea. Thank you.
Thanks so much. Take care.
Bye.
Thanks, everybody.